The third exercise that we would use when somebody is having anxiety or hyperventilation, if, for example, a hyperventilation attack kicks in, our breathing gets faster, upper chest, and often through the mouth, sensation of suffocation. So in order to alleviate the feeling of suffocation, we continue breathing faster in upper chest, but it's the worst way to breathe to alleviate the feeling of suffocation. A much better gas exchange takes place when we breathe nose slow and low. This is worth practicing when you're not having an attack. This is worth practicing when an individual predisposed to anxiety or panic disorder, when they're not having symptoms. And then when they are having symptoms, they can automatically revert to nose, slow and low. So I would like you to have your hands, 2 hands either side of your lower 2 ribs root, and as you're breathing in, that your ribs are just gently moving out. And as you're breathing out, your ribs are gently moving in. So you're allowing the shoulders to relax and directing your attention to the area of the ribs. And I'm going to have you breathe in for 3 seconds and to breathe out for 3 seconds. So you're breathing in, 2, 3, out, 2, 3, 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 and now just relax. So the 3 techniques again, if we're having symptoms of panic disorder, anxiety, hyperventilation, the first is small breath holds. This is the breathing recovery. That's breathing in and out and pinching the nose and holding for about 3 seconds and then letting go and breathing for normal for about maybe 4, 5 breaths and then repeating it. The second technique is when we're having symptoms is to think about cupping the hands and to think about the brown paper bag traditionally, that we want to pull carbon dioxide inside the hands and rebreathe that carbon dioxide back into the lungs to increase it in the blood, to increase blood flow to the brain, to increase oxygen delivery, to normalize blood pH, to calm the central nervous system. The third exercise that we were using then is, instead of breathing fast and shallow, which is very common when we feel suffocated, we naturally revert to breathing faster, harder and shallow. It's very inefficient and it reduces gas exchange. It's much better if we can think of breathing nose slow and low. So that's why you had your hands either side of your lower ribs, and as you breathe in, your ribs gently move out, and as you breathe out, your ribs are gently moving in. So those are the 3 techniques that we use when we're having symptoms, panic disorder, anxiety or hyperventilation.